Assalamu alaikum, ladies and gentlemen. I am Eamon Adnan and I welcome you all to another episode of Policy Hub on behalf of the Shahid Javed Barki Institute of Public Policy. Today we have Dr. Ijaz Sandhu with us as a guest who is going to talk about the state of digitization in healthcare in Pakistan. Sir, thank you very much for being with us. Before we go on into the Policy Hub, I would just like to introduce him in a few words that he is the Director of Research at Barki Institute of Public Policy. Before that, he has had a vast experience in academia and in space technology. Thank you, sir, for taking time out for us today. Sir, सबसे पहले तो kindly ये बताएं हमें कि what do you think is the current state of digitization of health in Pakistan?
I think before the current state of digitization of health, we should know about the current status of the health system in Pakistan overall.
Okay, sir.
And once we talk about the health system of Pakistan in general, but specifically there are three-tier system in Pakistan: the basic health units, then secondary health units, and then tertiary health units. Basic health units have further three different types of options: dispensaries, rural health centers, and basic health units at village level, at town levels. Then at the tehsil level, there is a tehsil headquarter hospital, THQ, which is called. Then DHQs, district headquarter hospitals, and then tertiary level teaching hospitals in major cities. This is the overall system, and there should be a link or connection between all these, which is important. Then the facilities which are available, and especially at lower level, we are lacking in certain facilities, which is directly linked to the public basically. So we have to create certain facilities at basic health unit system first of all, so that a proper linkage can be built before digitalization.
And sir, what kind of facilities? थोड़ा सा वो भी साथ बता दें.
Those facilities are first of all the HR, which is important because in most of the cases at basic health units, no doctor is available. Only paramedical staff is available. So we need basically doctors there. Proper health staff should be appointed there. Government did some efforts. Previously, the system was that doctor was getting in district headquarters hospitals higher salary than in basic health units. So they were discouraged to go back to the hospitals in basic health units. So later on they changed this system, and especially in KP. They post the doctors nearest to their house and they pay them higher salary. For example, in tertiary healthcare hospitals, if they are getting 100,000 per month, so in basic health unit they are getting 150,000. So there should be some benefit to the doctor while working at basic health units instead of tertiary care units. So that's why now they prefer to work in basic health units. The same should be applied all over Pakistan. The second issue is again, once you have deployed a doctor there, whether that doctor is sitting permanently there or not. That is another issue.
Is he fulfilling his duty as well?
Yes. That is important part. In most of the cases, which most of the time we noted that doctor is posted there, but the doctor is not available there. So with the help of digitization, we can maintain proper record. So this is one advantage which we can get. Now,
Sir, before the advantages and benefits, थोड़ा सा आप ये बताएं the state of digitization healthcare में that is available in Pakistan.
Yes, I was coming towards that. Okay. Digitization state is not as much as it should be. First of all, we talk about tertiary care hospitals. The softwares are there, which are being used for data recording purpose. But even at tertiary care hospitals, there no proper softwares are available.
Not even the private sector hospitals?
In private sector, they are available, but in government sector, they are missing. In district headquarter hospitals specifically. And in even teaching hospitals. ERP we used to see, enterprise resource planning system, should be placed in each hospitals. And then tertiary care hospital should be linked to district headquarter hospitals, and district headquarters hospital should be linked to Tehsil headquarter hospitals, and then Tehsil headquarters hospitals should be linked to basic health units, rural health centers, and dispensaries. So, integration process should be there in all stages of that. But at the moment, the proper digitalization is not available even in tertiary care hospitals. So we have to work hard basically to provide this facility to all levels of the healthcare system. Then there is another lady health workers are there, which used to visit the rural health system in the houses. They go and they get the data, and their data is again being maintained most of the time manually. And data entry time and another time is being wasted. Data acquisition process is lengthy. So basically it is required that they should be also equipped with some digital resources so that they can enter all data digitally, and then their data can be maintained in a central place. Once we talk about central place, that means we should have a data center.
On a government level?
On a government level. And that data center should maintain all health data at all levels, public and private both.
Fine.
There is one link that is again missing in some cases, that for example, in Peshawar, if we talk about, they have maintained some data center record system. But from private sector, if we talk about, that is link is missing. If we talk about health card system, that health card is being maintained basically by State Life Insurance Corporation of Pakistan. Whenever a patient goes to the tertiary care hospital, there are two separate systems in which data is being entered. One is the hospital system itself, and the second is the State Life Insurance agent system. So twice data is being entered. Wastage of time is there, wastage of resources is there. So once you develop the data center, proper record system, that should be linked to the data of the state life system also. So there should be integration between two systems. Instead of entering data at different places, that should be centralized, and it should be once entered in at a same place.
The effort is saved.
Effort should be less and time should be saved.
Yes.
And automatically the cost is linked to all this.
Sir, since you've talked about the centralization of data, so a pertinent question arises over here is that why would the private sector share their information with the government? Because we know the general culture of tax evasion and not opening, not being transparent with the information. This is a challenge. So what do you think about
I
that?
do agree with you, but the problem is, first we should have the data of the patient, which is important at both level, at public level and at private level. So certain level of data should be shared. We're not talking about the cost, that is the issue, taxation and other systems. So we can keep that cost separate, and the system, for example, if we talk about the data of the patient, what sort of data is required? First of all, first is identity, the name, ID card number, parents, data, gender,
disease and tests
disease,
prescribed or taken,
prescriptions, data. Advantage, for example, if we talk about prescription data, In most of the cases, at basic health unit specifically, if a patient comes, the purchase system is there, right? They take away purchase with them, prescription with them, and next time they come without that. So doctor does not know what was happened last time to that patient.
What was the diagnosis?
What is the record? What was the diagnosis? So if the data system is there, there is no need of giving purchase to the patient, right? Only the requirement is his or her ID card number. Once you will enter the ID card number, you will get all the record. And that will be easy for doctor. Time saving is also there.
Yes.
And record will be available. And now for doctor, it will be easy to prescribe further.
ठीक है sir. So another question is that we are talking about the benefits. For example, you've talked about saving the time, reducing the costs, reducing the efforts and resources, etc., on the part of the doctor, as well as making it facilitating for the patients. So, sir, a question arises that how can digitization be actually helpful for those people who are either illiterate or do not know how to use smartphones or laptops, or maybe just live in very very remote far flung areas जहाँ पर internet भी नहीं होता या signals नहीं पहुंच सकते. How are those people going to enjoy the benefits of digitization?
Right. You are talking about far-flung areas. Interestingly, in major cities, the problem is there. With respect, internet problem is still there. So once we talk about the data, the proper facilities, we have to provide basically these facilities at
all levels, all
grassroots level, basically, all level, and specifically at grassroots level. But once we will introduce technology, we have to train not only the user, also the facilitator, the paramedical staff, the doctors, and we have to provide technical staff in each hospital. So once we will provide technical staff in each hospital, in each paramedical units, then automatically there will be a market, job market will be created. And I will propose that specifically we should train females in this area.
In data entry?
In data entry. Because their interest is always more, they can work hard in rural systems specifically. So they can easily work there. And that job market can be created for rural women. Current status, if we talk about, for example, if we talk about the population, 100% population, say 50% is male, 50% is female. So out of 50% male, approximately as per data last year, 62% are working. Rest are not working, or they don't have job, or there are other issues. But once we talk about the female sector, only 23% are working. So 50% of population, out of 50% population, 23% are only working, and 70% already our population are low income group. So if female will work, automatically economic situation of the family will improve at rural level specifically. If we talk about farmers, 12.5 acre up to land, there are 93% farmers. So their family not only will be economically beneficial, also they will get some data out of that. And that can be helpful to maintain the system, to prepare another system for digitalization purpose.
And I think the same women can then also be hired to train other females in the locality.
Yes, that is called train of trainers process. Training of trainers process. TOT, which is we used to say. So automatically we train one person in one area, that can train 10 to 12% furthers. So there will be a process of training others, so that you can have a large scale manpower, human capital.
So an idea regarding this could also be, I mean, it's just popped into my head. Um, like you talked about training the technicians and keeping them with the doctor on the with the doctors and the hospitals. I think some people can also come to them directly, and that person can only be dedicated to entering their data, right? Even
Yes.
that can also take place, and
Yes.
also help the doctor as well in entering that data into the system or whatever, so that the doctor's time is not wasted. He or she can just keep on checking the patients and diagnosing the problem, while the technical staff, sorry, can enter the data as well and also help the people who are coming to him for booking appointments maybe or anything like that.
That can be at reception system where patient first comes. That reception system should be digitalized first of all, because that is the first entry point. The basic information of the patient can be entered there. Then the second level is paramedical staff, which is associated with doctor. If that paramedical staff is trained, then 70% of the burden of the doctor can be reduced, because the basic technical information of the patient about the disease, about the history of the patient, that can be entered by that paramedical staff. So the work of doctor will be reduced. So time will be saved, cost will be also saved. For example, in manual system, if doctor is handling 10 patients per day, this way doctor can handle 30 patients per day.
Yes, that's the idea.
Right. So the maximum benefit to the patient can be provided, the public at the large.
Sir, what do you think? Why have we arrived at such a situation that there are many hindrances in the digitization of health in Pakistan? अभी तक हम लोग क्यों पीछे रह गए?
The major problem is again awareness. That is just because of lack of awareness, the advantage of the digitalization. The second is we don't have manpower. The old manpower which is used to work manually, they have a fear to lose the job. So if we train them, and we should reduce their fear process, then they will not lose the job. They can work hard automatically. So that is the major reason that this fear process has reduced the process of digitalization in Pakistan overall. There are certain case studies are there. For example, in railway, once this was introduced, it took almost 20 years.
The same process?
It's the same process. Implementation. First failure, second failure, third failure, because the HR was not ready to accept that. The second issue is again the major corruption. Once you will introduce digitization process, the corruption will be reduced automatically. There will be a transparent system. Right? Time management will be also there, because if the worker is not ready to work 8 hours a day, they are usually habitual of working 3 hours, 4 hours. And through digitalization, they are forced to work 8 hours a day. So there will be always resistance against the change. It is a natural process. But for how long? So once we will start process, it will take 10 years, 20 years, but automatically it will be implemented, established.
Okay. So any other hindrance, any other problem because of which we couldn't?
Problems are there, but I think there is a major advantage of this system, which we have not yet discussed. That is the referral system.
Yes.
Okay, currently, the process is that the patient directly landed in tertiary care hospital because they think that the better facilities are there. But most of the cases, 70 to 80% patients are those which don't require basically tertiary care facilities.
Their issues can be resolved on the lowest
at
level.
lowest level. But once the system will be there, second, the advantage will be there also at that level. But the major issue is that once they landed in the tertiary care hospital, without any referral system, without any data, without any history, so the load at the tertiary care is there, and along with that, the manpower is handling the patients which are not required to be handled there. So we have to create some system, not only the digitalization, trust system basically at lower level. That trust is lacking basically. Once the trust system is there, the people will automatically go to the primary healthcare units instead of directly landing into the tertiary care health units.
Also, when they will know that the doctor would be available.
Doctor will be
the
available,
facilities
they
and the
will be
medicines.
properly cared.
Yes.
Actual issue is they think that they will be not properly cared, not looked after. This is the major issue.
Fine, sir. Sir, apart from that, do you think so there's a readiness on the government's level in order to bring digitization in health?
Readiness is there, but the problem is the lack of funds. And now World Health Organization, WHO, and there are certain other organizations which are working on this to provide this digitalization system to the government. There was a plan 3 years back. I visited Secretary Health, and there was a plan of 200 district upgradation of 200 district headquarter hospitals in Punjab, which is still in process. Not only they will be upgraded with reference to the facilities, technical facilities, medical facilities, along with that, this software should be upgraded and that will be.
I'm sorry, sir. Please continue.
The best software which we have, that is PKLI. Okay. And that type of software and Shaukat Khanum. So these type of softwares should be introduced in all levels so that you can have a centralized data system.
Fine. All right, sir. And sir, now last, what do you think? How can we outline a way forward in this scenario for bringing in digitization for better healthcare provision?
Yes. First of all, we have to establish a data center. Then a software should be linked to all first tertiary care hospitals, public and private both, in cities. Then second level, we should link to the district headquarter hospitals. Then we should link to the Tehsil headquarter hospitals, which is a secondary DHQ and THQs at secondary level. Then basic health units, rural health centers. So a downward integration is important with respect to that. It will take 4 to 5 years at least, with if we provide funds to implement all the system.
Fine.
So government effort is required, but not only the government effort, along with the government, other agencies should also cooperate in this respect.
Nice. So anything at all that you would like to add as a side note to this entire thing? Given you have a huge experience in this digitization field as well.
Currently, if we talk about Pakistan only, at Pakistan, as per WHO data, around 5,000 basic health units are working in Pakistan. If we talk about Punjab only, there were 36 districts previously. Recently, there were further more added districts. So now 41 districts are there. And in each district, 3 to 4 tehsils are there. So we take 3 at least, so that's mean 120 at least tehsils are there. So 41 district headquarter hospitals, then 121 tehsil headquarter hospitals, then each tehsil has 10 to 20 villages. So if we talk about this way, we work this way, that means in Punjab only, we need 3,000 basic health units. And overall, if talk about Pakistan, we need 10,000 basic health units. Currently, we have 5, even though Pakistan's this system is one of the best system in the world, but still we are lacking. Not only the number of basic health units, also the facilities.
So of course, it also has to do with the rising population and the
Yes, there
administrative.
are currently 100,000 lady health visitors all across Pakistan. And if we talk about the population which they are handling, so
the ratio is mismatched, pretty
mismatched.
Yes, yes.
And they are unequipped basically. They should be equipped.
True, sir. So, sir, thank you very much for
Welcome.
today's talk and taking time out for us. Ladies and gentlemen, this is all for today. I hope that this session was enlightening when it comes to the digitization of health in Pakistan, the current status, its benefits, why it's needed so much, and along with the benefits, what are the impediments that Pakistan is facing in terms of digitization of this sector. So let's hope that the decision makers understand and work more vigorously towards procuring more funds for this particular cause, and this, as this is going to bring more benefit to the user as well as the ones who are facilitating. It's a very lucrative business offer for the private sector as well. So hoping for better partnerships in the future. With this, we have come to the end of this session. Until next time, goodbye.